Good morning, and thank you for joining us for SBB Live. I am your host and the publisher of Seniors Blue Book, Amanda Barton, and I am delighted this morning to bring on one of our partners from Physicians Regional Hospital, Dr. Alexandra Grace. How are you this morning?
Hi, how are you? Thanks for having me.
Absolutely. I want to start off by just allowing our viewers and our readers to get to know you as a physician. And then I want to hear all about what you specialize in.
Perfect. Well, like you said, my name is Dr. Alexandra Grace. I'm a gastroenterologist. I am born and raised in Florida, actually, and I've been in the Naples area for just over 5 years now. So I specialize, gastroenterology is mainly things like the digestive disease tract, anything from reflux to constipation to IBS, and I do colonoscopy. So we have a wide range of things that I take care of.
Fantastic. Now, today our topic is specifically on GERD. We use a lot of acronyms in the healthcare industry, so why don't you start by telling us what GERD stands for and what types of symptoms you may experience if you're suffering from it.
Perfect. Yeah. So definitely GERD. You'll know why we shorten it. GERD is gastroesophageal reflux disease. So in layman's terms, it's basically reflux or heartburn or indigestion. We kind of use those, all three of those synonymously. And it's basically, it can range in a variation of symptoms. You can get anything from kind of burning up your chest. If you see commercials, they'll say, oh, it's like burning all the way up, a bad taste in your mouth. Some people actually get bad breath. Some people don't get as typical of symptoms. So they'll get throat clearing, where they're kind of going all the time, a dry cough, voice changes can even cause it. So there's a wide variety of symptoms, and some people don't get any symptoms from it. It's something that we find incidentally when we're going to look for something else.
And what are some of the risk factors involved with not addressing reflux or not addressing it quickly enough?
So reflux can be very minor. It can be a mild inconvenience for somebody who's eating some spicy food and they know that when they eat those spicy wings, they're going to get some discomfort that evening. But it can actually lead to long-term damage in the esophagus. Damage in the esophagus can lead to narrowing in the esophagus, like strictures, so which can cause trouble swallowing. It can also lead to precancerous conditions and even cancer in the esophagus. So those are the more significant, severe things that we worry about. And one of the reasons we kind of want to get it under good control so that you don't get the more severe symptoms or even, again, cancer is the main big concern that we see with this.
Yeah, it's definitely a scary word. So you want to make sure you pay attention to the smaller details and take care of it before it's a problem, I'm sure. Now, what are some of the new treatments out there right now that you guys are working with at Physicians Regional Hospital to help with this particular disorder?
Well, a lot of the treatments for this, first to diagnose this, we usually do procedures like an endoscopy. So it's kind of like the colonoscopy, but through your mouth. So we take a scope while you're asleep. We look in your mouth, esophagus, stomach, and the first part of your small intestine. And that we can actually look and see if there's any signs of any damage, any narrowing. Not only are we diagnosing, but like if there is a narrowing, we can actually treat it so we can stretch things out. And so that's the first major, I guess, test that we would do to diagnose this. And then the treatments range from anything from lifestyle changes. So, modifying, watching the foods that can worsen reflux, eating late at night can worsen reflux. Those are some things that we always encourage patients to do. But then there can be the more significant things like taking medications, or in a rare occasion, sometimes even reflux surgeries, where we kind of do things to kind of tighten up the valve at the bottom of your esophagus to make things where they can't come up into your esophagus. The most common things that I see patients and we treat with are medications. You've heard of like Nexium and Prilosec and some of those medicines. And then the others are the Pepcids and the Tagaments. So those are the most common things that we use. And we try and use those for short periods to get people's symptoms under control, and obviously not cause any significant side effects from being on medications as well.
Sure. And from someone that suffers with constant tummy problems, I can totally relate to everything that you're saying. So shifting gears just a little bit, when should someone be concerned about constipation and when should they seek care?
So constipation is very common, and a lot of people have constipation throughout their life. And constipation is when it's more difficult for you to have a bowel movement. Some people will still have a bowel movement every day, but they'll say, "Oh, I'm really straining a lot. I have little pebbles." I have people constantly tell me I look like I have rabbit pellets. And that's something that's very common, and it's treatable. And again, oftentimes what we worry about with constipation is more if it's something that's a newer symptom. So if you have always been an everyday kind of person where you go to the bathroom every day, you do your business, you have your coffee and you're done. If you suddenly start going 2 or 3 days without a bowel movement, we start worrying about, is there something wrong? Is there something structurally that's making things difficult? Or is there sometimes some problems with like your electrolytes or your thyroid or other things that we find in lab work can also make you constipated. So we like obviously if it's causing lifestyle changes, that's time when you should see somebody because we have treatments. But if it's a new thing for you, that's definitely some time when you should see either your primary care or someone like myself, a gastroenterologist.
And you specialize in so many more things than just the two topics that we've talked about. Do you have any closing remarks, maybe a case that you're working on now that's really interesting that you want to talk to our readers about or our viewers?
Ooh, can't think of anything right now, anything interesting. We for reflux standpoint, since we kind of touched on that, I have a very lovely patient who is a healthy 96-year-old who started having trouble swallowing, which was new for him. And he came to see his primary care, who sent him to me. We did an endoscopy and we actually found a very early cancer in his esophagus. And, he's a very healthy, people think, well, what are you going to do? He's 96. Well, he's a great 96. He's a healthy 96. Everyone is different and we have options no matter what. So we're getting him actually some treatments to help shrink this up and give him kind of nice ease of swallowing and really give him, hopefully a couple more healthy, active years of swallowing that's easy and getting rid of this cancer if we can. So that's kind of, I guess, been my most interesting case. But we range from everything from the mild to the severe. So
that's a beautiful testimony for that gentleman. And I'm so glad that he came to you and seek treatment and didn't ignore it.
Absolutely.
I think that we're finding a lot of people are putting off things like that due to COVID and they're nervous about going into the hospital or doctor's offices. And you're probably seeing an influx of people waiting until it's too late for treatment. So I'm really glad to hear that he came. And that was
absolutely. And actually for the last, definitely encourage people to go because we've had 2 this week of people with some, what hopefully should have been treated as outpatient diverticulitis. Mm-hmm. And both of them actually came into the office. They waited because they were afraid to go in. And, their CAT scans actually show one had a little perforation in their colon, so a hole in their colon, mm-hmm. and another one got an abscess. So, those from what should have been just some mild treatments with antibiotics at home, now they're unfortunately in the hospital for a couple of days getting more significant treatment. So we definitely want to do everything we can to keep people out of the hospital, but we don't want you getting to the hospital where then you're going to end up needing a big surgery.
Yeah, exactly. Thousands of dollars more that you wouldn't have had to spend if you had gone in,
absolutely
in early time. So don't delay your care. I think that that was actually an article in Seniors Blue Book that Physicians Regional submitted. And it's very important that we talk about that. So
absolutely.
Well, thank you so much for your time this morning. Sorry to put you on the spot with the
no, thank you for having me.
All right. I appreciate it, Dr. Grace. You have a wonderful day.
You too. Thanks so much.
Bye-bye.